provide for privacy. Wash my hands, and I check my order, and we have an order to do a blood draw through our patient's PICC line. And then I would introduce myself. Hi Bob, my name's Michelle. I'm going to be your student nurse today, and I see here that we have an order to do a blood draw from your PICC line. Is that okay? He says yes. Can you verify your name and date of birth with me? He says Bob Smith, 1132, and that matches. So we're just going to get a few things ready here. I have my supplies ready. So have you had the blood draw done before? He says yes. So you know how this works. We're just gonna flush the PICC line. We're gonna draw back a little blood and not use that. We're gonna draw back a little bit more, and that's what we'll be using. And then we're gonna flush through to make sure everything's out of there. Is that okay? He says yes, so he's able to understand any commands. So can I have you keep your arm still? Is that okay? And he says yes. So we're going to check his IV site, or his PICC line site, I should say, for any redness, edema, ecchymosis, drainage, and the approximation of it, and everything here looks good. You'd want to make sure that he has a 4 French or larger, which he does, which is good. And if he had any fluids running into this line, I'd want to make sure to shut them off unless they were life-saving or it was TPN. If it was TPN, we wouldn't want to use that line. So we just want to avoid it at all costs. But everything here is good, so we're just going to cleanse this and get this ready. If our facility required, we would also use a heparin flush, but we do not need to, and this facility requires us to use alcohol swabs for our cleansing agent. And we're cleaning for 15 to 30 seconds. Get that ready. And then we're going to do our first flush. Make sure any air is out of here. We don't want any bubbles going in. Everything here looks good. So we'll get this on. And our date that we checked was already, all of our flushes are within expiration limits, so we are good with that. So we're going to push this through just with normal saline. We'd unclamp that. And then we're going to do our waist. We'll draw back. All right. Clamp that and twist. Put our cover on. We're going to set that aside. We're going to cleanse again for about 15 to 30 seconds. And this one's going to be our specimen. So once this is dry, you can twist this on. And our order says for about 8 mL of blood, so that's what we're going to draw back. Nice and slow with this. We'll set this aside because we need to be using this. Cleanse again. We're going to do 2 flushes. Since this is a PICC line that we're using, we need to pulse the flush to break up anything that could possibly be in the line. And after we cleanse for 15 to 30 seconds, we'll get this ready. Any air out? Everything's good on that one. Unclamp, and we're pulsing. Once our flushes are done, if our facility required us to, we would change the end cap on there, but this facility does not require us to do so, so we do not need to. Get any bubbles out. First, we want to cleanse. Now we can put it on. You're doing good, Bob? He says yes. And we're pulsing again. All right. That's that. And then we'd want to get our blood sample ready. So we'd open up our package with our vacutainer in there, that our transfer device. Keeping the ends sterile. Twist that off. You want to twist this on. And then you'd want to use your vacuum container, and you'd want to go in the order specified, but this one we only need the one container. So we'd want to clip that on and turn it up. And then it'll fill automatically, whatever it needs. All right. Pull that off. And then you'd want to turn to make sure everything gets mixed. Alright, and then you'd want to grab your label. Sometimes this facility requires tape, some require an already pre-made label, so you'd want to put that on your container. Make sure that gets sent down to the lab. Fill out any paperwork relating to that or online work that you need. You'd want to make sure that you leave an opening for this. You'd want to take your gloves off, dispose of them in the proper area, dispose of all your supplies, wash your hands, make sure your patient's safe. The bed is in a low position, call light within reach, patient's comfortable, and then you'd want to document the date, the time, any assessment information, and then anything regarding your lab specimen. And then if this was a pediatric patient, you'd want to offer them a stuffed animal for comfort, or have a parent be with them. Even though you're not poking them, sometimes they can still get a little scared, so you want to make sure you do all that.